She had been invisible for 5 years. They made sure of that. And the night they finally needed her, really needed her, was the night she made them remember every single time they looked through her. The doors blew open at 11:42 p.m., and the world Anna Beckett had carefully constructed around herself came apart in under 4 seconds. 6 men in tactical gear, 1 stretcher. Blood, not the managed, controlled kind that hospitals deal with, but the dark, arterial kind that means a body is losing the argument with gravity. She saw the entry wound first, then the pallor, then the face. Her clipboard hit the floor. She knew that face. If this story already has you holding your breath, stay with me until the end. Like this video, drop a comment telling me what city you're watching from and follow along so you don't miss what happens next. I want to see how far this story travels. Anna Beckett had come to Riverside Valley Medical Center in Fairmont City the way people come to places they don't intend to stay, quietly, with no forwarding address and a resume that had been carefully edited down to almost nothing. She had a nursing license, 4 years of documented clinical experience she'd pulled from a period after her discharge, and a manner so controlled and colorless that most of the staff had already stopped seeing her within her first month. That was the point. She wore beige scrubs on purpose. She kept her locker empty except for a spare pair of shoes and a protein bar she replaced every Monday. She did not eat lunch with the other nurses, not because she was unfriendly, but because the less people knew about her, the less they'd eventually want to know. She was good at her job in a way that didn't invite questions. Efficient, fast, never rattled. The kind of nurse who could start an IV on a collapsed vein in under 30 seconds without making a show of it. The kind of nurse who filed her paperwork at the end of every shift, never left a patient note incomplete, and was somehow always where she was needed before anyone asked. None of that mattered to Dr. Victor Hale. Hale had been chief of the emergency department for 3 years, which was long enough to have calcified every bad habit he'd arrived with, and added several new ones. He was technically proficient, Anna would give him that, but he ran the ER the way insecure people run things they're afraid of losing, loudly, with constant demonstrations of authority and a particular radar for anyone who might make him look small. He had identified Anna in her second week. Beckett, he'd said it the way you say a word you're not sure how to pronounce. He was standing at the nursing station, chart in hand, and he looked her over the way you'd look at a piece of furniture that had been placed in the wrong room. You did a field reduction on the patient in Bay 4 without waiting for the attending. The attending was 40 minutes out, Anna said. The patient's shoulder was dislocated. She was in significant pain. That's not your call. I documented everything. She's comfortable now. He'd stared at her for a moment with an expression she recognized. The kind men get when someone smaller than them does something they couldn't fault but wanted to anyway. You're a nurse, he said, as if reminding her. You change sheets and you relay information. That's what I need from you. She held his gaze just long enough to make it clear she'd heard him. Then she went back to her charting. It didn't get better. If anything, it got more specific. Hale had a way of delivering corrections in the middle of handoffs, in front of residents, in front of patients. Little surgical embarrassments designed to establish a hierarchy that he apparently felt needed constant reestablishment. Beckett, did anyone ask for your assessment? Beckett, when I want nursing input, I'll request it. Beckett, this is a trauma room, not a field hospital. That last one had landed differently than he intended, though he didn't know it. Anna had simply nodded and updated the medication chart. She had survived things that would end Victor Hale in under 20 minutes. She could survive his commentary. The ER nursing staff had sorted themselves into 2 camps regarding Anna Beckett, the ones who thought she was stuck up and the ones who thought she was just private. Delia Marsh, who had been an ER nurse for 11 years and had a gift for reading rooms, had landed somewhere in the middle. She'd watched Anna long enough to notice things. The way she assessed a patient's breathing before she looked at their chart, the way her eyes tracked the room during a busy shift, like she was doing constant math in her head, the way she never once flinched at blood or noise or chaos. You've worked trauma before, Delia had said once, not a question. Some, Anna said. Where? Different places. Delia had let it go because she was smart enough to recognize a wall when she walked into one, She and Anna had settled into something that wasn't quite friendship, but was warmer than professional courtesy. The kind of understanding that develops between people who are good at the same difficult thing and know it without needing to discuss it. That Tuesday night in March had started the way bad nights always start. Too full, too fast, and with every bed already occupied before the shift hit its midpoint. A 3-car accident on the 9 freeway had fed them 6 patients in under an hour. A cardiac arrest had come in from a nursing home. A teenager with a catastrophic allergic reaction had required Anna's full attention for 40 minutes that she'd had to carve out of a shift that didn't have 40 minutes to spare. She was at the medication cart at 11:38 when the radio traffic started coming through. She didn't mean to hear it. The charge nurse's station was 10 feet away and the volume was up because the night had been loud. But the codes being relayed from the incoming transport were wrong. Not wrong the way a confused dispatcher is wrong. Wrong in a way that made something in Anna's chest go very still. GSW, multiple. Entry wound, left lateral thorax. Patient hypotensive, tachycardic, GCS dropping. ETA 4 minutes. She capped the syringe she was holding and listened. The paramedic on the radio was professional, steady, running through the vitals with the flat efficiency of someone who'd done this before. But there was a pause before he said the next part. A half-second gap that told Anna he was deciding how to phrase something. Patient is military. We have personnel on scene requesting the trauma team be made aware. There are tactical considerations. She put the syringe down. The ER doors blew open 4 minutes later, exactly when the radio said they would. Anna was already at the edge of the trauma bay. She saw the tactical gear first. 6 men, 2 of them with their hands still on the stretcher, the others peeling off to cover the doorway with the automatic body positioning of people who had spent years going through doors they weren't sure were safe. Not security contractors. Not regular military. The kind of stillness and spacing that came from a specific kind of training that most people never encountered. She saw the blood next. And then she saw his face, and the clipboard went down. Caleb Voss had been 28 the last time she'd seen him, crouched behind a collapsed wall in a place she wasn't going to think about right now, pressing her hands against a wound in her side and telling her in a completely calm voice that she was not, under any circumstances, allowed to die on him. He was 34 now, maybe 35, and he was losing the same argument with mortality that she had been losing that night, except the math was worse. She could see it from 12 feet away. The pallor wasn't just blood loss. It was the specific gray-white of a body that had been compensating for a while and was starting to stop. His respiratory rate was elevated and shallow, the kind of breathing that looks like someone working very hard at something that shouldn't require effort. His neck veins were, "Trauma Bay 1, let's move." That was Hale, sweeping in from the attending corridor with the authority of a man who had heard military patient and decided this was an opportunity. He had his coat on, his ID clipped, and the expression he wore when he wanted the room to feel his presence. "What are we looking at?" The paramedic relayed the handoff. GSW left lateral thorax, field tourniquet not applicable due to location, 2 large bore IVs established in the field, BP 78/40 and dropping, heart rate 138, oxygen sats 89 and falling. Hale nodded, processed, made a decision. "Get him stabilized and let's get him to CT. I want imaging before we go in. I need to know what we're dealing with." Anna said, "Don't move him." It came out quieter than she intended, which was why it landed the way it did. The room didn't stop exactly, but it shifted. The particular shift that happens when a sound doesn't fit the script everyone was running. Hale turned. He looked at her the way he always looked at her. Beckett. His neck veins are distended, his trachea is deviating, BP is in the floor, and his saties are dropping on supplemental O2. She moved to the side of the stretcher, not asking permission. He has a tension pneumothorax and probable hemothorax, but moving him for imaging will kill him. He doesn't have time for a CT. "I didn't ask for your assessment. Stop." Her voice had changed, not louder, but different in a way that made Delia Marsh, across the room, look up from the crash cart. "You're going to kill him." The room went strange and quiet. One of the tactical operators near the door had turned to look at her. Fully, the way people don't usually turn when a nurse speaks. Hale's expression went cold. "Step back, Beckett. Now." She didn't step back. She looked at Caleb Voss on that stretcher, at the gray spreading across his face, at the way his chest was moving, asymmetrically, the right side rising and falling, and the left side barely participating. She looked at the deviation she could see at his throat, subtle, but there, the kind of finding that meant minutes, not a discussion. She looked at Hale. "You have a tension pneumo on the left. He's got blood in the chest cavity that's compressing his heart. Every minute we wait for imaging is a minute his cardiac output is dropping." She was talking fast now, but her voice was level. "He needs a needle decompression right now, and then we're going straight to a thoracotomy prep. He does not have time for a scan." "You are a nurse," Hale said, and his voice had dropped into the register he used when he was genuinely angry. "You are not a physician. You do not decide the course of treatment in my trauma bay." "Then decide it," she said, "but decide it right." One of the operators had moved, not toward her. He'd moved closer, and he was watching her face, and his expression had gone from hostile suspicion to something that looked oddly like recognition. "Who are you?" he said. She didn't answer him. She looked at Hale. The monitor above Caleb's stretcher alarmed. Heart rate 148, BP 71/38, SATS 86. "He's crashing," Delia said from across the room. Hale looked at the monitor. He looked at the patient. She could see him running the calculation, the ego against the math. And for a moment she genuinely didn't know which one was going to win. He was smart enough to see what was happening. He was also the kind of man who had built his authority on never being wrong in front of a room. "Get imaging," he started. "No." Anna moved to the supply cart, already reaching. "I need a 14-gauge needle, a chest tube tray, and a thoracotomy kit. Now." She said it to Delia, not to Hale, because Delia had 11 years of experience and knew a dying patient when she was looking at one. "And I need everyone in this room to understand that if we wait another 2 minutes for a physician to come around to what I'm already telling you, this man does not survive this night. Beckett, if you touch that patient, then stop me," she said. She said it without turning around. The monitor screamed. Caleb Voss went into a lethal arrhythmia, and the room exploded into the controlled chaos of a crash. Bodies moving, the crash cart rolling, voices overlapping. And in the middle of all of it, Anna Beckett moved with a stillness and precision that was the opposite of the noise around her. Her hands knew what to do before she told them. She located the landmark by feel and memory, swabbed the site, angled the needle, and felt the rush of air that told her she was right. The tension broke. The compressed lung began to re-expand, and Caleb's oxygen saturation climbed 2 points in the next 30 seconds. Delia was already prepping the chest tube tray without being asked. A second-year resident named Torres had appeared at the foot of the bed and was watching Anna's hands with an expression that was not the expression of someone watching a nurse. "Chest tube," Anna said. "I have it," Delia said. Hale was standing at the edge of the trauma bay. He hadn't moved. His arms were at his sides and his face was doing something complicated that Anna didn't have the bandwidth to interpret right now. "BP's coming up," someone called. "Such 82/44. SATs are 91, someone else said. The arrhythmia resolved. Caleb Voss took a breath that actually moved his chest. Anna exhaled. Not obviously, not in a way anyone would notice, but there it was, the small internal acknowledgement that the worst immediate crisis was past. She had bought him time. Now she needed to figure out how much time they actually had, because the decompression in the chest tube had addressed the mechanical problems, but there was still blood in that chest cavity that needed to come out, and the artery she suspected was damaged wasn't going to repair itself. "He needs a surgeon, and he needs an OR, she said, and this time she was looking at Torres, because Torres, she'd already decided, was the person in this room most likely to make a decision based on medicine rather than ego. "I want a cardiothoracic consult. His left internal thoracic artery is compromised. I can't confirm that without imaging, but the bleed pattern and the presentation are consistent." Torres was already reaching for his phone. "You don't give orders in my department," Hale said. But his voice had changed. The certainty was gone. What was left was something raw and harder to name. "I'm not giving orders," Anna said. She stripped off her gloves, reached for a fresh pair, didn't look at him. "I'm telling you what this patient needs. What you do with that is your call." She meant it. She had stepped in because Caleb was going to die in front of her if she didn't, and now that the immediate crisis was managed, she was stepping back because the last thing she wanted was to be in the center of this room. The last thing she'd ever wanted was to be in the center of any room. But one of the tactical operators was still watching her. He had not taken his eyes off her since she'd caught the neck vein deviation from across the room meet. He was mid-30s, dark eyes, a jaw that suggested he'd taken some impacts in his life and absorbed them, and he had the particular quality of stillness that she recognized because she'd spent years around people who had it, the kind of stillness that comes not from being calm, but from being so trained that calm is just the default. "What's your name?" he said. "Beckett," she said. "Anna Beckett." He looked at her for a long moment. His eyes went to her hands specifically, the way they'd moved on the patient, and then back to her face. "You've done that before," he said. "That's not a hospital thing. That's not even a trauma nurse thing." "Your guy is stable," she said. "That's what matters." "It matters," he agreed. "But that's not what I asked." She picked up Caleb's chart and started updating it, because that was what came next, and also because it gave her somewhere to look that wasn't at him. The next 40 minutes were a controlled sequence of escalations. The CT that proved her right about the arterial damage, the conversation with the cardiothoracic attending who arrived looking sleep-deprived and became progressively more alert as he reviewed the presentation, the arrangements for an emergency OR. Hale existed in the periphery of it, technically present, functionally sidelined by the momentum of people doing what needed doing. He made a comment about documentation. He asked someone to update the incident log. Neither of these were the things he actually wanted to say. Anna was cleaning up the trauma bay at 12:48 in the morning when Delia appeared beside her. "You doing okay?" "Fine." That was... Delia paused, assembled words. "I've been doing this for 11 years, Anna. I've seen good nurses. I've seen great nurses. I have never seen anything like what you just did." "I recognize the presentation," Anna said. "It wasn't complicated." "It was absolutely complicated. Torres is still in there talking about it. Hale is on the phone with someone, and he doesn't look happy." A pause. "The military guys? 3 of them are still here. They're asking about you." Anna kept working. "They should be with their guy. Their guy is in surgery. They're in the waiting area asking about the nurse." Another pause. "One of them used a call sign. He asked if anyone knew." Delia stopped. Anna looked up. Delia was watching her carefully. "He asked if anyone knew a medic called Whiskey 6. The room didn't move. The fluorescent lights buzzed at exactly the frequency they always buzzed. Somewhere down the hall, a monitor alarmed and a resident answered it. All of it happened exactly as it always happened, and the world looked completely the same as it had 3 seconds ago. Anna set down the chart she was holding. "Tell them," she said slowly, "that I'll be out in a minute." Delia held her gaze for a beat. She had a lot of questions. Anna could see every single one of them, and she was grateful that Delia was the kind of person who knew when not to ask them. "Okay," Delia said, and she left. Anna Beckett stood alone in the empty trauma bay for 23 seconds. She counted them. It was something she'd learned to do a long time ago, in places that didn't look anything like this, when she needed to put something away before she could move forward. You gave the feeling 20 seconds. You let it be real. And then you put it somewhere it couldn't interfere. She thought about Caleb Voss telling her she was not allowed to die. She thought about the 3 operators waiting in the corridor, at least one of whom already knew something he shouldn't. She thought about Victor Hale, on the phone, not happy. She unclipped her ID badge, looked at it for a moment, Anna Beckett, RN, Riverside Valley Medical Center, and then she clipped it back on, straightened her scrubs, and walked out of the trauma bay. They were standing near the family waiting alcove, 3 men in tactical clothing that had been partially cleaned up, but still carried the evidence of a bad night. The one who'd been watching her. She had him now as the ranking member of the group, not by insignia, but by the way the other 2 were oriented toward him without realizing it, looked up when she came around the corner. She stopped 6 feet away. They looked at each other for a long moment. "You're Riggs," she said. She didn't ask it. Something moved across his face. "Staff Sergeant Daniel Riggs, yes, ma'am," he said. We were with the 3rd Special Forces Group. I was a junior operator when you—" He stopped, recalibrated. "I was there. I know who you are." "I'm a nurse," she said. "You're Whiskey 6. She held his gaze and said nothing. "We've been trying to reach you for 8 months, Riggs said. "General Thorne has been— There's a situation that we need to— Your man is in surgery," Anna said. "That's what you need to focus on right now. Caleb told us about you. Before this mission, he said if anything happened—" "Did he know you were coming here?" Riggs blinked. "He requested Fairmont City Memorial as the closest level 1 to the extraction point. When we got redirected to Riverside Valley, he was already—" He paused. "He was already gone under. He didn't know where he was." She absorbed that. "He asked for this hospital," she said quietly. "For Fairmont City." "He knew you were here," Riggs said. "He knew. He's the only one who tracked you down. He never told command. He just kept it, like insurance." A pause. "Or like hope." Down the hall behind her, she heard a door open. She heard footsteps that didn't belong to anyone on the night shift. She heard Hale's voice saying something sharp and official sounding, and then she heard another voice, older, with the particular cadence of someone who has given enough orders that giving them is just breathing. Respond in 4 words that made the skin at the back of her neck tighten. "I'll handle it from here." She turned slowly. At the far end of the corridor, Victor Hale was in conversation with a man in military dress uniform who was not supposed to be in this building, who had not been here 20 minutes ago, and who was looking directly at her with the expression of a man who had been looking for something for a very long time and had just found it. General Marcus Thorne. She hadn't seen him in 4 years. He looked older. He looked tired in the way that command makes men tired, the kind of exhaustion that doesn't come from lack of sleep, but from the weight of decisions. And he was looking at her with something that she recognized, after a moment, as relief. He started walking toward her, and Anna Beckett, who had spent 5 years becoming invisible, who had built her anonymity so carefully and completely that she'd almost believed it herself, felt the walls of it come apart in the 20 feet between them. He crossed the corridor the way men like Thorne always move. Not fast, not slow, with the particular deliberateness of someone who learned long ago that urgency and speed aren't the same thing. Hale was saying something behind him, some administrative objection about restricted access and visitor protocols, and Thorne wasn't ignoring him exactly. It was more that he had already categorized Hale as a problem that would be dealt with in order, and right now Anna was first in the order. She didn't move toward him. She also didn't back up. "Captain Beckett," he said, when he was close enough that he didn't have to raise his voice. "I'm not a captain anymore," she said. "No," he agreed. He stopped 3 feet away and looked at her the way you look at something you weren't sure still existed. "You're a nurse named Anna Beckett, who just performed a needle decompression and directed a trauma team with the kind of situational command that takes a decade of combat medicine to build." A pause. "I have the nursing staff's incident report already. Word travels. It's been 4 hours. I've had people watching this hospital for 6 weeks," he said simply. "Caleb wasn't the only one who knew where you were." Something moved through her that wasn't quite anger and wasn't quite relief. It was the feeling of finding out that the door you thought you'd locked from the inside had been unlocked from the outside the whole time. "Then why didn't you come sooner?" she said. "Because you have the right to disappear," Thorne said. "I wasn't going to override that." He glanced past her toward the OR corridor, but tonight changed the calculation. Behind her, Riggs and the other 2 operators had gone quiet. Hale had stopped speaking. The hallway had developed that particular held breath quality of people who know they're witnessing something they don't have the context for. Anna looked at Thorne for a long moment. "How bad is it?" she said. "The mission. Whatever Caleb was doing." Thorne's expression answered before his words did. "That conversation is not for this hallway." "Then it waits," she said, "until I know he's out of surgery." He studied her. "Fair enough." She turned away from him and walked back toward the trauma bay because she needed to be somewhere that made sense, and the hallway wasn't it anymore. Amen. What happened next happened slowly, the way disasters usually do. Not one catastrophic moment, but a sequence of smaller decisions that, assembled together, added up to something that couldn't be undone. Hale found her at the nurse's station at 1:15 in the morning. She was charting. He sat down across from her, actually sat, which was unusual. He was a pacer, and she could feel the shape of what was coming before he opened his mouth. "I need you to understand what happened tonight," he said. "I understand what happened tonight. What happened tonight is that a nursing staff member performed invasive procedures without physician authorization in front of military personnel in a way that could expose this hospital to serious liability." He had his hands flat on the desk, which was something he did when he was trying to look reasonable. "I'm not saying the patient didn't benefit. I'm saying the process was wrong." Anna set down her pen. His pressure was 71/38. His SATs were in the 80s. He was in a lethal arrhythmia. "You ordered imaging." "I ordered imaging because, without confirmed diagnosis, I gave you the diagnosis. You are not a physician." "I know what I am," she said. He looked at her steadily. "I'm going to file an incident report. There'll be a review. You should know that now." She picked up her pen again. "File it," she said. "I documented everything." He sat there for another moment, like he was waiting for something. Some sign that she was rattled, some crack in the surface. He wasn't going to get it. After a while, he stood up and left. Delia appeared from around the corner of the medication alcove 3 seconds later, which meant she'd heard all of it. She didn't say anything. She just refilled Anna's coffee and set it down beside the chart, and Anna understood that for what it was. The OR report came through at 2:40 a.m. Caleb Voss was out of surgery. The cardiothoracic attending, a surgeon named Dr. Patricia Guo, who had the efficient manner of someone who didn't have patience for dramatics and the skill to back it up, had repaired the left internal thoracic artery and cleared the hemothorax. She told Riggs in the waiting room that if the field intervention and the chest decompression had happened 20 minutes later, there would have been nothing to repair. Anna heard this secondhand from Torres, who had apparently spent the last 2 hours making himself useful in the periphery of the situation and had developed the slightly dazed expression of someone whose understanding of what a nurse could do had been recalibrated significantly in a short period of time. "He's in the ICU," Torres said. "Stable. They're saying the next 12 hours are the critical window, but his numbers are good." Anna nodded. "Dr. Guo asked who did the field management," Torres said. "When I told her it was you, she asked me to repeat that. Then she asked how long you'd been an ER nurse." He paused. "I told her 4 years here, and she kind of looked at me like that wasn't the right answer." "Go home, Torres," Anna said. "Your shift ended an hour ago." He went, but slowly. She found Thorne in the family consultation room at 2:55, sitting in one of the chairs that was designed to make difficult conversations slightly less uncomfortable and mostly failing at it. Riggs was with him. The other 2 operators had finally been convinced to get food from the cafeteria, which was a miracle of persuasion that Anna suspected Thorne had engineered to get them out of the room. She closed the door and sat down. "Talk," she said. Thorne had his hands folded on the table in front of him. He looked at her for a moment, taking inventory, she thought, of 5 years of distance. And then he said, "Caleb's team was 8 days into a cross-border recovery operation. They were extracting a signals intelligence asset who had been burned by a compromise in the communication chain." He stopped. "The compromise originated domestically." Anna went still. "Someone with access to the mission parameters fed extraction timing and coordinates to the opposing network," Thorne continued. "Caleb's team walked into a prepared ambush, 4 operators. Caleb is the only survivor." She had known, somewhere in the math of the night, that the numbers were going to be bad. But hearing it said that way, the only survivor, did something to the air in the room. "Who else knew the parameters?" she said. "That's the question we're currently working backward from," Thorne said. "The access list is 9 names. We've cleared 7. 2 are still under review." He looked at her directly. "One of the uncleared names is someone with a connection to your current operational environment." She felt the sentence land and sat with it. "Say that plainly," she said. "Someone with access to the mission parameters has a documented administrative relationship with Riverside Valley Medical Center," Thorne said. I cannot say more than that right now because the investigation is active and the connection may be coincidental. He paused, and she could hear in the pause that he didn't think it was coincidental. But it is why I'm here personally, and it is why I needed to find you. Anna looked at the table. She thought about the last 5 years, the beige scrubs, the careful emptiness, the protein bar she replaced every Monday. She had come here specifically to be nowhere, to be connected to nothing, to be the kind of person that nothing important could find. She had been so deliberate about it. You think someone in this hospital fed that information, she said. I think someone with administrative access to this hospital may have a secondary identity that intersects with a network we've been tracking for 14 months, Thorne said, which was a very precise way of saying yes. And you need me because you're already here, Riggs said. He said it quietly, not the way someone says something tactical, but the way someone says something true. Because Caleb specifically told us 8 months ago that if the mission parameters ever got exposed, the person he trusted most to understand what that meant and to not panic and to actually help us work it out was you. A pause. He said that before he knew the mission would go sideways, he said it because he knows who you are. Anna was quiet for a moment. He told you I was here. He told us a lot of things, Riggs said. He didn't tell us everything, but he told us that. The consultation room was very quiet. Down the hall, the ICU would be running its night protocols. The soft alarms, the hourly checks, the specific hush of a unit that was keeping people alive by margins. Caleb Voss was somewhere in that hush, breathing with repaired machinery, alive because Anna had been in the right corridor, at the right moment, with the right hands. Or because he'd planned it that way. You said he requested Fairmont City, she said. Riggs nodded. He requested this city knowing I was here, knowing that if things went wrong, he'd land close to the one person he trusted, Riggs said. Yeah. She put that in this place where she put things that were too large to deal with immediately, and she stood up. Tell me the name, she said. The one with the administrative connection. Thorne shook his head. Not yet. The investigation is happening in my hospital, Anna said. If someone in this building is connected to what happened to Caleb's team, I need to know who I'm working next to. You're not being asked to work this investigation, Captain. Don't call me that, she said. And I'm not asking for permission. I'm telling you that I work in this building, and if there's a threat here, I'm not going to walk around blind to it because the paperwork isn't finished. Thorne looked at her for a long moment. She could see him making the calculation. The operational security argument against the practical one, the weight of protocol against the weight of having spent a decade watching Anna Beckett make correct calls under pressure. Administrative access, he said carefully. Financial authorization level, connected to the hospital's third-party contracting network. He stopped. That is all I can give you. She filed it. I want to see Caleb. He's sedated. I know, I still want to see him. Thorne nodded. Muttered. The ICU nurse on duty was a young man named Porter, who had the energy of someone still in his first year, and the instinct to recognize that the woman walking in with a general and 3 special forces operators was not someone to redirect to the waiting room. He took them to bed 7 without being asked twice. Caleb Voss looked smaller than he had on the stretcher, which was always the way. The adrenaline of a trauma bay makes people larger, and the ICU makes them human again. He was intubated, sedated, wired to monitoring that was doing the job of watching every system in his body simultaneously. His color was better. Not good, but better. The gray was gone. Anna stood at the rail and looked at him for a while. She remembered him pressing her hands against her own wound and talking to her. Just talking, a steady, low voice about whatever came to mind, keeping her conscious while the medevac was inbound. He talked about his mother's cooking. He talked about a camping trip he'd taken as a kid. He talked about the kind of car he wanted to buy when he got home. She hadn't remembered half of it, and she'd remembered all of it. She put her hand over his briefly and then took it back. Don't do that again, she said quietly, which was a ridiculous thing to say to a sedated man. She said it anyway. She turned around and walked back to the corridor. At 4 a.m., the shift began cycling toward its end, and the administrative machinery of the hospital started warming up for the day. Anna was restocking the trauma bay when she heard the noise from the direction of the nursing station. Not the noise of a medical situation, but the different kind, voices raised in the particular register of an institutional confrontation. She came around the corner and found Hale. He was at the station with two people she didn't recognize, not clinical staff, not security, suits at 4 in the morning, which meant administration. And he was talking in a low, rapid voice with the energy of someone who had not gone home but had spent the hours since their conversation building something. Delia was at the far end of the station with her arms crossed, watching. Anna moved to Delia's side. "What is this?" "Hospital administrator and someone from legal," Delia said quietly. "They came in 20 minutes ago. Hale called them." At 4 in the morning. At 4 in the morning. One of the suits, the one with a lanyard that identified him as Michael Greer, Associate VP of Clinical Operations, looked up and found Anna. "Ms. Beckett," he said, "we'd like to speak with you." She walked over. The conversation that followed was 15 minutes of careful, institutional language that translated to, a nursing staff member had performed unauthorized invasive procedures. There was a question of scope of practice. The incident would be reviewed by the Clinical Standards Committee, and in the interim, her supervisor, meaning Hale, had recommended she be placed on administrative leave pending the outcome of the review. She listened to all of it without interrupting. When Greer finished, she said, "The patient survived. That's not in question. The patient had a tension pneumothorax, a hemothorax, and was in a lethal arrhythmia. The attending physician ordered imaging. I intervened. The patient survived." She looked at Greer steadily. "That is the incident." "The process. If I had followed the process," she said, "Sergeant Voss would be dead. You can put that in your review." Hale had been listening from the edge of the group. "Anna," he said, and it was the first time she could remember him using her first name, which was interesting. "This isn't personal. There are protocols because protocols protect patients." "They protect patients when the people following them know what they're doing," she said. "Tonight they would have killed one." Silence. She looked at Greer. "Am I being suspended?" A pause. "Placed on administrative leave?" "Same thing." "Do I need to leave the building now or at the end of my shift?" Greer looked at Hale. Hale looked at the desk. "End of shift," Greer said. She nodded. "Then I have 2 hours of work left." She picked up a chart. "Excuse me." She walked away from all of them and went back to work. Delia caught up to her at the medication alcove. "They can't actually do this," she said. "You saved his life. Everyone in that trauma bay knows it." "They can do it," Anna said. "He's the department chief and they have a process argument. Torres is talking to people. The military guys are... I don't know what they're doing, but they're making calls." "Good." "Anna," Delia's voice dropped. "Are you okay?" Anna thought about it honestly. "I've been through worse," she said, which was not the same as yes, but was as close as she could get right now. She finished her shift at 6 a.m. She clocked out, picked up her bag from her locker, and was halfway down the corridor toward the exit when she heard Riggs behind her. "Ms. Beckett." She stopped. "Two things," he said, coming up alongside her. "First, Caleb's numbers are good. They're talking about extubation in 8 hours if he stays stable." "Good," she said. "What's the second thing?" He handed her a phone. Not her phone. A different one, secure by the look of the housing. "General Thorne wants you to have this, in case." He paused. "The hospital connection he mentioned. Our people ran it overnight." He glanced at the corridor around them, confirming they were alone. "It's not a contracting employee. The access point goes through the administrative authorization system, financial authorization, someone who can sign off on contracts and access vendor networks." Anna went still. "That level of authorization in this hospital," she said slowly, "sits with department chiefs and above." Riggs looked at her. "Department chiefs?" she said again. "And the administrator level above them." "We're still running it down," Riggs said. "But yes." She stood with that for a moment. The phone was solid in her hand. The corridor was empty and lit with the pale, exhausted light of a hospital morning. She thought about Victor Hale, calling administration at 4 in the morning. She thought about his hands flat on the desk, trying to look reasonable. She thought about the way he'd said, "I'm going to file an incident report," with the energy of someone who needed her out of the building, and the way she'd assumed, because she always assumed the simplest explanation, that it was just ego protecting itself. The simplest explanation. She looked at the phone in her hand. "Riggs," she said, "how long has your team known about the administrative connection?" "We confirmed it at approximately 3 a.m. And Hale called the administrator in at, "We know," Riggs said quietly. She looked up at him. "General Thorne is already working with federal investigators," Riggs said. "But Anna, they need someone inside. Someone who's already here, who knows the environment, who won't trigger alarm by being present." He met her eyes. "They need you to not walk out of this building." She looked at the exit door at the end of the corridor, 20 feet away. She'd been walking toward it. Then she looked down at the phone in her hand, and her shift was over, and she was suspended, and somewhere in this hospital, a man she didn't yet have a name for might have fed coordinates to the people who had tried to kill Caleb Voss, and had killed 4 other operators who would not be going home to anyone. She closed her hand around the phone. She turned around and walked back into the hospital. Not dramatically, not with any particular sense of resolution. She just turned around and walked back in because the math was simple, and she'd always been good at math. 4 operators were dead, 1 was breathing on a ventilator in the ICU, and somewhere in this building was a person who might still be useful to whoever had set that ambush, which meant the danger was not past, it was ongoing, and leaving was not something she could actually do. Riggs fell into step beside her without being asked. "I need to know what the federal investigators have," she said. "They're running parallel to us. There's an FBI counterintelligence team that was already active on the network breach. They've been working the domestic compromise angle for 6 weeks. When Caleb's mission went sideways, they elevated the case." "Are they in the building?" "Not yet. Thorne is coordinating. They're trying to keep the footprint small until they have enough to move." "How much do they need?" "Confirmation that the access point was used to pass mission parameters externally. They have the breach. They need the human at the end of it." Anna processed this as they walked. The hospital was shifting into its morning mode. The overnight staff cycling out, day shift beginning to filter in, the particular ambient noise of an institution waking up. She was supposed to be leaving. Her badge still worked because the administrative leave paperwork hadn't been processed yet, which meant she had a window, and she had learned a long time ago to treat windows as the resources they were. "Thorne said financial authorization level," she said. "Vendor network access. Walk me through what that means practically in a hospital." Riggs was quiet for a second. "You know this better than I do." "I know what I know. I want to know what your people think they know." Vendor network access means someone who can authorize third-party contractors, medical suppliers, equipment companies, IT maintenance firms. The kind of access that gets you into procurement databases, scheduling systems, sometimes facility network nodes depending on how the contracts are structured. He paused. The breach point was an IT maintenance contractor who had facility network access. Someone with authorization-level credentials approved that contractor's access permissions. She stopped walking. An IT contractor with facility network access. She'd seen those people. They moved through the hospital invisibly, the way she'd moved through it, except they moved through the infrastructure, the systems, the network architecture that ran the building, patient records, staff schedules, security feeds, or a military patient's intake record, which would have contained transfer origin and referring unit information. "They used the hospital's IT contractor network as a relay," she said. "That's the working theory." Which means the authorization person didn't necessarily know what they were passing, or they did and they've been very careful about how it looked. "Correct." She started walking again. "Who authorized the most recent IT contractor access approvals?" "That's what we're trying to narrow down. The authorization logs show 4 individuals with appropriate clearance levels who accessed the relevant permissions window in the 14 days before the mission parameters were exposed." Riggs kept his voice low and level. "Hale is one of the 4. She'd already known that, in the way you know something you've been not thinking about since the moment it became possible. It sat in her chest with a specific weight. Who are the other 3? Hospital Administrator Sandra Voss. No relation to Caleb, the name is coincidental. Chief of Surgery Dr. Raymond Kraft. And the CFO, a man named Douglas Fenner. 4 names. One of them possibly the thread that connected a suburban hospital in Fairmont City to a burned intelligence asset and 4 dead operators in a place she wasn't cleared to name. Possibly. The word did a lot of work. She needed to think. "I need coffee," she said, "and I need 20 minutes. Riggs nodded. "There's a family consultation room on 3 that's been cleared. Thorne will meet you there." The 20 minutes became 40, because Thorne was on the phone with the FBI coordinator when she arrived, and she spent the time drinking bad coffee and doing what she used to do in mission prep. Not planning exactly, but sorting, filing the known facts into the architecture of what made sense and what didn't. Hale calling administration at 4 in the morning. Hale, who had tried to get her out of the trauma bay when Caleb came in. Hale, who had recommended she be placed on administrative leave within hours of military personnel arriving in his department. Hale, who was currently, she glanced at the secure phone Riggs had given her, in the building because his regular start time was 7 and it was now 6:43. She turned the facts over and looked at them from the other side. It was also possible that Hale was exactly what he appeared to be, an arrogant department chief who'd called administration because a nurse had embarrassed him in front of military personnel, and his ego required a response. It was possible that his name appeared on the authorization logs because he was the ER chief, and authorizing IT contractor access was a routine administrative function of his role. Correlation was not evidence. She knew that. She had learned, in contexts where being wrong meant people died, to be very precise about the difference between correlation and evidence. But she had also learned to trust pattern recognition, and the pattern here had a shape. Thorne finished his call and sat down across from her. "Talk me through Hale," she said. He didn't ask how she'd gotten there. Victor Hale, 46. Medical degree from Weston University. Residency at a regional trauma center in the Northeast. 9 years at Riverside Valley. 3 as department chief. Unmarried. No children. Financial records show consistent spending at the outer edge of his income, but nothing that flags as unexplained. He paused. Prior to his medical career, he had a period of employment with a defense contracting firm. Administrative support role, 2 years before he went to medical school. The contracting firm has since dissolved. What did the firm do? Communications, infrastructure, government contracts, broad portfolio. She set down her coffee. That's not a red flag by itself. No, Thorne agreed. It's a data point. The FBI is running the dissolved firm's network for overlapping associations with the foreign network we've been tracking. How long will that take? Could be hours, could be days. She made a sound that was not quite a laugh. I might not have days. I'm on administrative leave. If the paperwork goes through today, I can't be in this building. I can delay that. How? Federal investigation takes precedence over hospital HR timelines, Thorne said. If the FBI formally designates this location as active to the counterintelligence case, your continued presence here becomes operationally relevant. That's a lot of architecture to build on a correlation. It is, he said, which is why I need you to tell me what you actually know about Hale from working with him, not what the file says, what you've seen. She thought about it honestly, which meant she had to separate what she felt about him from what she'd actually observed. She didn't like him. He'd been contemptuous and punitive and had spent 3 years making her professional life smaller than it needed to be. But feelings weren't data. He's territorial about information, she said slowly. He doesn't share more than he has to. Not with his team, not with administration, not with other departments. He runs the ER as a closed system. If you want to know what's happening in his department, you have to go through him. She paused. I always read that as ego, but it's also a useful structure if you're moving information. Thorne was quiet, listening. He came in last night before the patient even arrived, she said. He heard military personnel and he was there before the stretcher. I assumed that was about status, but he wanted to be visible for something that seemed significant. She stopped. Or he needed to control who had access to the patient intake records from the moment they were created. Thorne nodded once, slowly. I don't know, she said. That's all I have that's factual. The rest is inference. Inference has value, he said. What's your gut? She didn't answer immediately because she'd learned to be careful about answering that question. The gut was useful and also wrong in ways that mattered. She looked at the table for a moment. He wanted me out of the building before dawn, she said. Whether that's ego or something else, I don't know. But he moved fast. And he called people in at 4 in the morning for a nursing scope of practice dispute, which is not nothing. Thorne's phone buzzed. He looked at it. His expression shifted. Not dramatically, but enough. The specific shift of someone receiving information they'd been expecting, but hoping was still hours away. The FBI team is coming in, he said. They found something. What they'd found was a metadata trail in the hospital's IT access logs. Specifically, a pattern of off-hours access to the contractor authorization system that had been occurring at irregular intervals over the past 8 months, always from the same authenticated user credentials, always under 2 minutes in duration, always followed within 48 hours by the contractor's access permissions being briefly elevated and then returned to baseline. Brief. Invisible. Exactly the kind of modification that wouldn't flag routine monitoring. The authenticated credentials belonged to Victor Hale. Agent Diane Foley, the FBI counterintelligence lead, delivered this information in the consultation room at 8:12 a.m. with the flat economy of someone who had long since learned not to editorialize on evidence. She was mid-40s, precise, with the kind of institutional patience that Anna recognized. The patience of someone who worked on timelines measured in months, because the alternative was cases that fell apart before trial. This gives us the access point, Foley said. It doesn't give us intent, and it doesn't give us the communication chain. Hale can argue he authorized routine IT access as a standard administrative function, and the logs were used by someone else. Can that argument hold? Thorne asked. For long enough to create legal complications, yes, we need more. Foley looked at Anna. You worked directly with him. I did, Anna said. I'm currently suspended. Pending review, Foley said. Which hasn't been processed. Your badge works. A pause. We need eyes inside the department, not collecting evidence. We have forensic people for that. We need someone who can recognize operational behavior, who knows what's normal for that environment and what isn't. Anna looked at her steadily. You want me to watch him? I want you to be present in your normal environment and tell us if his behavior changes. I told you I'm suspended. Your suspension notice is sitting in an outbox waiting to be sent, Foley said. We can delay that outbox for 8 hours. After that, if we don't have what we need, you need to be out of the building anyway for evidentiary reasons. 8 hours. She thought about Caleb in bed 7, breathing on borrowed time and repaired machinery. She thought about 4 operators who hadn't made it to any ICU. She thought about 5 years of deliberate invisibility and how completely, irreversibly done that was. She thought about Hale saying, "You're a nurse. You change sheets," and what a neat little box that had been for her to sit in. All right, she said. She went back to work the way she always went back to work, without announcement, without explanation, sliding into the rhythm of the ER as if the last 6 hours had been a long bathroom break rather than the unraveling of her carefully constructed life. The day shift staff gave her looks ranging from confused to relieved. The night shift people who were still finishing their handoffs looked at her with a kind of solidarity that she appreciated and didn't acknowledge because acknowledging it would have made it ranging from confused to relieved. The night shift people who were still finishing their handoffs looked at her with a kind of solidarity that she appreciated and didn't acknowledge because acknowledging it would have made it strange. Hale arrived at 8:30, saw her at the nursing station, and went completely still for exactly 2 seconds before he recovered. Beckett, he said, you're supposed to be... The paperwork hasn't gone through, she said. I'm here until it does. He looked at her with an expression she couldn't read cleanly. There was something in it that was more than professional irritation. She filed it and kept moving. The morning was busy in the specific way hospital mornings are busy. Not emergency level, but relentlessly full. The kind of shift that doesn't give you space to think because every time you finish one thing, there are 3 more behind it. She worked. She was good at working. She triaged, assessed, administered, documented, and kept one layer of her attention on Hale at all times with the background quiet of someone who had done surveillance under significantly more hostile conditions. He was edgy. That was the clearest word for it. He moved through the department with less of his usual deliberate authority and more of the tight, overmanaged energy of someone monitoring themselves. He made 2 phone calls that she saw him take in the break room with the door shut, which was unusual. Hale typically took calls in the corridor or at the station, where his visibility was an asset. He accessed the nursing station computer twice for purposes that weren't clinical and looked at the screen with a focus that didn't match what he claimed to be doing. At 10:15, she sent a 2-word text on the secure phone. "He's moving." The response came from Riggs 20 seconds later. "We see it. Stay visible." At 10:47, one of Hale's IT contractors arrived. Not a scheduled visit. She knew the maintenance calendar because she'd worked near it for 3 years, and nothing was scheduled today. The contractor was a young man with an equipment bag and a work order that, from 12 feet away, looked like it had been printed within the last hour. She watched Hale meet him at the department entrance. She watched them exchange words, brief, angled away from the camera coverage at the nursing station, which she didn't think was accidental. She texted, "IT contractor just arrived, unscheduled." Hale met him at the door. Response, "Don't approach. Give them space. We need to see where it goes." She turned back to her chart and kept working, because the hardest part of surveillance was looking like you had somewhere else to be. The contractor was in the department for 11 minutes. He worked on a network junction panel in the supply corridor, routine-looking work, the kind of thing that would read as maintenance on any review, and then packed up and left. Hale watched him go from the nursing station with the careful non-expression of someone managing their face. She texted the timestamps. 3 minutes later, her phone buzzed. The contractor flagged. "Known associate of the foreign network. FBI is picking him up outside. Don't change behavior." She was in the middle of an IV restart when Foley's voice came through the secure earpiece she'd been given, the second piece of equipment Riggs had produced, small enough that her hair covered it. Hale just used the contractor as a courier, physical media, USB. The contractor passed it to a vehicle outside. "We have the vehicle. We're running it now." She taped the IV site and smiled at the patient, who did not know that the nurse's hands were completely steady because she had learned to make her hands completely steady regardless of what her brain was doing. "We're close. Keep eyes on him." She kept eyes on him. What she saw over the next 40 minutes was a man coming apart in very small increments. He made a 3rd phone call and came out of the break room with a jaw muscle working. He asked the unit secretary about the status of the administrative leave paperwork, her paperwork, in a tone that was trying to be casual and wasn't. He went to the computer at the physician's station and sat there for 3 full minutes without typing anything. At 11:34, General Thorne walked into the emergency department. He came through the main entrance with Foley beside him, and 2 people in suits behind them, and the room did the thing rooms do when people with authority enter. The ambient noise dropped by 10%, and the staff recalibrated toward whatever was happening at the door. Hale turned from the physician's station and saw Thorne. The color left his face. Not gradually. It left in the way color leaves when a body gets a signal that supersedes everything else running. Thorne walked toward him with the measured deliberateness he'd had in the corridor 8 hours ago, except this time there was no consultation being extended. This was something else. "Dr. Hale," he said. "General?" Hale's voice was controlled but thin. You don't have authority to—" "Agent Foley does," Thorne said, and stepped aside. Foley presented identification and said, in the practice language of federal procedure, that she needed Dr. Hale to accompany her, that he was not under arrest at this time, but that his cooperation was required in connection with an active federal counterintelligence investigation, and that anything he said could be used. She said it without drama, the way you'd read a bus schedule. The ER had gone almost completely quiet. Anna was at the nursing station 10 feet away. She didn't move toward the scene, and she didn't move away from it. She stood where she was and watched Victor Hale's face do the thing faces do when the architecture of a life starts to fail its own structure. "I want a lawyer," he said. "That's your right," Foley said. "We'll arrange that." "I'm the chief of this department. You can't just—" "We can," Foley said. "We are." They walked him out. It took under 90 seconds from the moment Thorne came through the door. The room watched it happen the way crowds watch something shocking. with the specific silence of people who haven't yet processed what they've seen enough to react to it. Delia appeared at Anna's elbow. She looked at the door. She looked at Anna. "Did you know?" she said. "Not for certain," Anna said. "Not until this morning." Delia was quiet for a moment. "The patient he ordered to imaging last night would have died on the table," Anna said. "Yes." Another silence. "He did that because he wanted to control what got documented about the intake," Anna said. "Not because he was trying to kill Caleb. I don't think he knew in that moment who was on that stretcher. He wanted to manage the records before anyone with military credentials could review them." She stopped. "But the effect was the same." Delia pressed her lips together. Then she picked up a chart and handed it to Anna. "Bay 3 has been waiting 20 minutes, she said. "Chest pain, 52-year-old male, diaphoretic on arrival." Anna took the chart. She went to Bay 3. The rest of the morning had the surreal quality of an aftermath. The ER running its normal operations while federal agents worked in the administrative wing and the staff absorbed, in pieces, what had just happened to their department chief. Torres showed up for his shift and stood in the corridor for 4 full minutes, reading a text message before he could move again. The hospital administrator, Sandra Voss, called a department heads meeting that was postponed twice. The unit secretary answered the phones with the slightly glazed affect of someone whose understanding of her workplace had been significantly updated. Anna worked. She was doing a suture on a laceration in Bay 6 when Riggs appeared in the doorway. "Caleb's being extubated," he said. Her hands didn't stop moving. "Numbers still good?" "Stable all morning. Dr. Guo cleared it." "I'll be there in 20 minutes." She finished the suture, clean, tight, methodical, and told the patient to keep the site dry. She stripped her gloves, washed her hands, updated the chart. She did all of it in order, because that was how you did things when the world was moving at a speed that made disorder easy. She was in the ICU at 11:58. Caleb Voss was breathing on his own. He looked bad. The specific honest bad of someone who'd had a chest opened and a ventilator doing their work for hours. But his eyes were open and tracking, which was the thing that mattered. He looked at the ceiling for a moment when she came in, and then he turned his head, and when he saw her face, something moved across his that she was not going to analyze right now. "Hey," he said. His voice was raw from the tube and barely above a whisper. "Don't talk," she said. "I'm going to talk," he said. He stopped, adjusted for the pain, tried again. "I've been planning this conversation for 8 months. It can wait 8 more minutes. Anna." She looked at him. "You're here," he said. Like it was a fact he'd needed to verify. "I'm here," she said. He closed his eyes for a second, and she saw in that second the relief of someone putting down something very heavy. When he opened them again, he looked more like himself. "The team," he said. She didn't answer immediately. "Tell me," he said. "You need to focus on... Tell me." She looked at him. She owed him the truth the way she always had, which was directly and without softening it into something easier. "You're the only one who came back," she said. He absorbed that. He didn't close his eyes again, which she thought took more out of him than anything else in that room. He stayed present with it, which was the hardest thing to do with information like that, and she watched him do it. And she didn't look away. "We walked into it," he said. "I know. Someone burned the parameters." "I know that too," she said. "Riggs and I we've been working on it." She paused. "FBI picked someone up this morning." His eyes sharpened. "Here?" "This hospital," she said. "It's complicated. You don't need the full picture right now. I need... Caleb." She moved closer to the rail. "You died twice last night. You get 12 hours before you need the full picture." He looked at her for a long moment. "You saved my life," he said. "You saved mine first," she said. "We're not even." He almost smiled, the almost being the most he could manage, and it was enough. She stayed another few minutes and then left because the department needed her, and he needed to rest, and the space between those two things was where she had always lived, the useful gap between what was urgent and what was important. She was in the elevator on her way back to the ER when the secure phone buzzed. "Foley." She answered. "We have a problem," Foley said. "Hale's lawyer arrived 20 minutes ago. We expected that. What we didn't expect is who the lawyer works for. Anna waited. The firm that sent the lawyer has known connections to the foreign network we've been tracking, which means Hale's legal representation was prearranged, which means he knew we were coming, Anna said. Before this morning, yes, which means someone told him. The elevator reached the ER floor, and the doors opened. Anna stood in the open doors for a second without moving. Someone on the investigative team, she said, or someone with access to the investigative team's communications. A pause. Anna, we need to know how much Hale had time to move before we got to him. The USB the contractor picked up. The vehicle we followed went to a parking structure downtown, and we lost it in the structure. The media may have been transferred. She stepped out of the elevator before the doors closed on her. What was on it? We don't know yet, but given the timing and his behavior this morning, we believe it may include information about Caleb's current location and status. The hallway was ordinary. Nurses walking, carts rolling, monitors beeping at their normal frequencies. Everything exactly as it should look. You think someone is coming for him, Anna said. Foley didn't answer immediately, which was its own answer. We're increasing security on the ICU floor, but Anna, if whoever Hale was working for knows Caleb survived and knows where he is and has reason to believe he can identify the compromise, they won't leave him in the ICU, Anna said. No, Foley said. They won't. Anna was already moving back toward the elevator when she heard it. Not an alarm, but the wrong kind of quiet on the ICU radio frequency coming through Porter's walkie at the nurses' station down the hall, the specific silence that meant someone had turned off a transmitter that was supposed to be on. She broke into a run. The elevator was too slow, so she took the stairs. 3 flights, the secure phone still at her ear, Foley's voice cutting in and out as Anna hit the stairwell door at full stride and took the steps 2 at a time. It wasn't a run she'd done in 5 years, but the body doesn't forget that kind of movement. The weight forward, the arms driving, the specific economy of someone covering ground with a purpose. I need the ICU security feed now, she said into the phone, and someone needs to reach Riggs. He's already moving. We lost contact with the ICU floor security post 40 seconds ago. Lost contact how? Radio went dark. The posted agent isn't responding. She hit the ICU floor door and came through it fast, slowing only because running in a hospital draws exactly the kind of attention that makes situations worse. She moved at the edge of a walk, reading the corridor as she went. The nurses' station, 2 staff members who looked normal, the family waiting area to her left, the corridor to the patient rooms bending right. Porter was not at the station. That was wrong. Porter had been there when she left, doing his rounds charting with the reliable predictability of a first year trying to look on top of things. The station was empty and the monitoring screens were running normal feeds, but the chair was pushed back at an angle that meant someone had left it in a hurry. She scanned the board. Bed 7, Caleb's room, showed normal vitals, but the monitoring system could run on a 30-second delay, which was enough. She moved down the corridor. The door to bed 7 was closed, which it hadn't been when she left. The small rectangular window showed the room was lit, and she could see the shape of Caleb in the bed, and she could also see a second shape near the door inside that resolved as she got closer into a man in a maintenance uniform with his back to her and his hand doing something she couldn't see clearly to the IV line running to Caleb's arm. She didn't stop to think about what came next because thinking about it would have slowed her by a second, and a second was not available. She opened the door. The man turned. He was 30-ish, solid, with the particular stillness of someone trained to function in high-stress situations, not panicking at the door opening, already calculating. His other hand was at his waist, where a jacket covered what Anna assessed in under 1 second as a sidearm. She said, "Step away from the line." He didn't step away from the line. She had crossed the room before he completed the decision-making process for his next move, because the decision-making process takes fractions of seconds longer than muscle memory does, and she had a great deal of muscle memory for close quarters, and none of it was gentle. She caught his wrist before his hand reached the weapon, used his own momentum and the geometry of the IV stand between them, and put him into the wall with enough controlled force that the window rattled. He was trained. She'd known that before they made contact, and she felt it in the way he absorbed the impact and tried to redirect. But trained in a clinical environment against someone expecting a nurse was not the same as trained against someone who had spent years in places where getting this wrong meant not going home. She had his weapon hand-pinned and his arm at an angle that removed the option of using it. He made 2 more attempts, fast, purposeful, and she countered both, not cleanly, because she took an elbow to the ribs on the second one that she was going to feel for days, but she had the mechanical advantage and she kept it. "I said, step away from the line," she said again, and her voice was the voice that had stopped a trauma bay. He stopped moving. Caleb was awake. She'd registered that in the periphery, his eyes open, tracking, doing the assessment that his body was not yet capable of acting on. He looked at the man against the wall, and then at Anna, and his expression was the expression of someone who had just watched something they'd suspected for years get confirmed. She heard running in the corridor, and then Riggs came through the door with 2 of his operators behind him, and the situation resolved in the way situations resolve when armed people with authority enter a room. Quickly, without further negotiation. The man from the maintenance uniform was on the floor with his hand secured before Porter came back around the corner of the corridor looking pale and bewildered. He'd been sent to retrieve a piece of equipment from the supply room by someone he'd described as a facilities supervisor, which was how you cleared a post without raising an immediate alarm. Clean and simple. This had been planned. Riggs looked at the IV line. "Did he get to it?" he asked. Anna checked the connection, the drip chamber, the port access. There was residue at the IV port. Something had been injected or partially injected before she came through the door. "Porter," she said, "I need a medication analysis kit, and I need the attending physician for this room right now." "What did he put in?" Riggs said. "I don't know yet." She was already clamping the line above the port site. "Caleb, how do you feel? Any change in the last 3 minutes?" Caleb's voice was strained. "Dizzy. Thought it was the meds." "When did it start?" "Maybe 4 minutes ago. I figured, it's not the meds." She had the line clamped and was already calculating. 4 minutes, onset of dizziness, whatever concentration had made it through before she interrupted the injection. Not a lethal dose if she'd caught it in time. Possibly not. "I need an IV restart in the other arm, and I need to know what we're dealing with before I can reverse it." Porter had the kit. He was scared and doing his job anyway, which was the right combination. The next 18 minutes were medical and exact. Dr. Guo arrived at a run and took over in the way attending physicians are supposed to take over, which was by adding her expertise to what Anna had already started rather than replacing it with a slower process. The substance was identified from the remaining residue in the IV port as a potassium chloride concentrate, enough to induce cardiac arrest if fully administered, delivered in a setting where the presenting cause of death would look like a post-operative complication in a critically injured patient. It had almost worked. Anna stood at the foot of the bed while Guo managed Caleb's care, and she thought about how close the math had been. 3 more minutes of uninterrupted access, and the question of who burned Caleb's mission parameters would have died with him, and whatever Hale had been trying to protect would have stayed protected. "He's going to be fine," Guo said finally. "The amount that got through wasn't enough to do significant damage. His potassium is elevated but manageable." She looked at Anna over the bed rail with the specific expression of someone assembling a larger picture. "How did you know?" "Porter wasn't at the station," Anna said. Guo absorbed that. "A missing nurse." And the door was closed. Guo looked at the door. She looked at Caleb. She looked at Anna. "All right," she said, which covered a great deal of ground. Foley arrived on the ICU floor at 12:47 with the controlled urgency of someone whose case had just expanded in a direction that had significant implications. The man from the maintenance uniform was in federal custody. His identification was manufactured. Good work, but the kind of good work that FBI forensics could dismantle, and they were doing that in real time while Foley stood in the corridor outside Bed 7 and absorbed the update. "This changes what Hale's lawyer can negotiate," she said. "Attempted murder of a federal witness is not a charge you work down to a fine." "Is Caleb officially a witness?" Anna asked. "He is as of 40 minutes ago when I filed the paperwork." Foley's expression was precise and satisfied in a way that she was keeping mostly internal. Hale's legal team was prearranged, which we now have evidence of. The attempted access to Sergeant Voss constitutes a coordinated effort to suppress witness testimony in an active federal investigation. Combined with the IT access logs and the contractor courier, we have enough. Enough for what exactly? Enough to charge. Enough to hold. Enough that his lawyer's first call after leaving the consultation room was to a number that we've been watching for 14 months. Foley paused. Hale made one phone call before his lawyer arrived. We have the number. It goes to a burner associated with the same foreign network. Anna looked at the floor for a second. He knew Caleb was here, she said. He saw the intake. He knew who was in bed 7 before any of us understood what last night meant. Yes. He ordered Caleb moved to imaging because he needed to access the records, and because a patient who died en route to a CT scanner is cleaner than, we believe that's the case, Foley said. We can't prove intent on that specific action, but the totality of the evidence is... She stopped. It's significant. Anna thought about Victor Hale standing at the edge of the trauma bay while she decompressed Caleb's chest. She thought about the color leaving his face when he realized the patient was going to survive. She'd read that at the time as ego, as the specific humiliation of a man watching a nurse do what he should have done. And that was part of it. She didn't think she'd been entirely wrong. But under the ego there had been something else, something colder, and she had been so careful to separate correlation from evidence that she'd spent the night reading only what she could prove. He had wanted Caleb dead, not because he was malicious in the way of ordinary men, but because Caleb alive and lucid in an ICU bed was a threat to something that Hale had spent years building, and the math of that was simple and brutal. She had saved Caleb's life twice in 12 hours. What happens now? She said. We go get him, Foley said. Okay. What that looked like in practice was not the cinematic version of a federal arrest. It was 4 FBI agents, a set of federal warrants, a hospital administrator who had been briefed 20 minutes ago and was still processing it, and Victor Hale being located not in an interrogation room but in the hospital's second-floor conference room where his lawyer had set up a working space. Anna wasn't in the room. She was in the corridor outside with Thorne, which was where she'd been directed to be. And she stood there and watched through the wired glass panel in the door as Foley and her team entered and the shape of the conversation changed. Hale's lawyer, a composed man named Barrett, whose composure was currently doing significant work, stood and began an objection that Foley cut off by placing a document on the table. She spoke. Hale read the document. His lawyer leaned over and they had a rapid, low exchange, and then Hale looked up at Foley and his face had the look of someone whose calculations have just returned an answer they weren't prepared for. Thorne was beside Anna, not speaking. He had his hands behind his back and he was watching the conference room with the patience of a man who had waited for this particular moment through 14 months of a case that had started somewhere else and had, by a series of events none of them had planned, ended here. What was the original case? Anna asked. The one the FBI had running for 14 months. A signals intelligence compromise, Thorne said. We identified a leak in a communications network being used by 3 active operations. The leak had a domestic origin point that we couldn't pin. We'd been working backward through the network, identifying the foreign end first, then tracing the communication chain toward its domestic source. He paused. Hale was never a primary target. He wasn't on our radar until his hospital came up in the contracting network analysis. He was what? A cutout? A useful asset with access they needed. The hospital's IT contractor network gave them a relay point inside a medical system which has different security architecture than a government or military network, harder to monitor routinely. And Hale's personal financial situation, Thorne paused, chose his words. He had debts he hadn't disclosed, the kind that create leverage. So not ideological, not a man who believed in something and acted on it. A man who had been found at a vulnerable point and had made a series of decisions from there, each one binding him more completely to the thing he'd agreed to, until the thing he'd agreed to required him to let a soldier die on a hospital stretcher rather than let the thread be pulled. She thought about that, the ordinary corruption of it, the specific mundane horror of a man who had wanted money and had become something that tried to kill people in ICU beds. And she felt the particular cold clarity that comes not from anger, but from understanding. He called me a nurse who changes sheets, she said. It wasn't directed at Thorne exactly. It was just a thing that came out. Thorne looked at her. He was afraid of you, he said. From the moment you stepped forward in that trauma bay, he was afraid of what you represented. I represented a patient who was going to survive. You represented someone who knew things he didn't want known. Thorne was quiet for a moment. He couldn't have told you that. He had to make you small instead. Through the glass, Hale was talking now. His lawyer had his hand out in a restraining gesture, the professional signal for stop talking, and Hale was either ignoring it or couldn't. His face had the look of someone who had run the calculation and found that the only option with better odds than silence was speaking. The door opened and one of Foley's agents came out and said something to Thorne in a low voice, and Thorne's expression did the thing it did when information confirmed something he'd already suspected. He's cooperating, Thorne said. Already? The attempted murder charge changed the negotiation significantly, Thorne said. He didn't authorize the ICU operation. He passed the information, Caleb's location, and status. But the decision to act on it was made by someone else in the chain. He didn't know they were going to move that fast. Does that matter? Anna said. Legally, for his sentencing, potentially. Operationally, for what we can get from him. Yes. Thorne looked at her. He's giving us the chain, the communication structure, the cutouts, the method, everything the FBI has been trying to reconstruct for 14 months. She absorbed that. He traded 4 dead operators and an attempt on a 5th for a plea negotiation, she said. Yes. How does that feel to you? Thorne was quiet for a moment. Like the way these things actually end, he said, which is not the way you want them to end, but what it gets us, the network, the chain, the foreign handlers, that matters more than the specific sentence a man in Fairmont City serves. She understood that. She didn't have to like it to understand it. At 2:30 in the afternoon, Michael Greer from administration found Anna at the nurse's station with the expression of a man who had been briefed on an extraordinary amount of information in a short period and was still working out the implications. Ms. Beckett, he said, Mr. Greer. He stood there for a moment with the administrative leave paperwork. She could see it in his hand, the same document that had been sitting in an outbox all morning. He looked at it. He looked at her. I've been on the phone with the hospital's legal counsel and with an FBI liaison for the past hour, he said, and with Dr. Kraft, who is the acting department chief. He paused. There are going to be a number of conversations that need to happen over the next several days. I imagine so, she said. The incident report Dr. Hale filed will presumably be reviewed in light of current circumstances, she said, not unkindly. He looked at the paperwork in his hand. He looked like he wanted someone to tell him what to do with it, and she was not going to do that for him, because that was his job. The Clinical Standards Committee will still need to convene, he said, which was the administrative equivalent of needing to save some face. Proper process is important, she said. I agree. Convene the committee. He blinked. He'd expected resistance. She didn't have any, because she documented everything and she knew what a clinical standards review would find, and she was tired of the conversation. The administrative leave is being rescinded effective now, Greer said finally. He put the paperwork in the recycling tray next to the station, which was a small but complete gesture. We'd like you to continue your shift if you're able. I've been working my shift, she said. He processed that. Yes, he said. I see that. He straightened. Thank you, Ms. Beckett, for last night. And for... He gestured vaguely at the general situation, which covered a great deal of territory. It's my job, she said. Mostly. He left. Delia materialized from the medication alcove. She had not been in the medication alcove for the last 4 minutes. She had been listening, and both of them knew it, and neither of them addressed it. Mostly, Delia said. Mostly, Anna confirmed. Delia smiled. It was a small, real smile, the kind that happens when something that has been wrong for a long time gets corrected, and the correction isn't triumphant, but it's still, quietly, a correction. Thorne found Anna in the stairwell at 4 p.m. Not dramatically. She was sitting on the top step of the third-floor landing, eating half a protein bar, which was the first thing she'd eaten since the previous shift, and he came through the door and sat down beside her with the unself-consciousness of a man past the age of worrying about where the sitting happened. "Hale's in federal custody," he said. "Full cooperation in process. His lawyer is working the sentencing angle, but the charges are going to be significant. Conspiracy to commit espionage, obstruction of a federal investigation, and the attempted murder charge on Caleb won't be dropped regardless of the cooperation." She chewed, swallowed, looked at the opposite wall of the stairwell. "The 4 operators," she said. "Their families are being notified today, if they haven't been already." He paused. "Their names will come out eventually. The mission will stay classified." "There'll be footnotes," she said. Not bitterly, just accurately. "In the public record, yes. Not in the unit. Not to the people who know." He looked at her. "Not to you." She finished the protein bar. She was tired in a way that had gone past the physical. The specific depletion of someone who has been operating at high intensity for 16 hours on resources that were already finite when the night started. "You're going to ask me something," she said. "You've been building toward it since you walked into this hospital." Thorne was quiet for a moment. "There's a position," he said. "A joint military-federal medical advisory role. Working with special operations medical teams on field protocol, trauma management, the intersection of tactical and clinical. It's been sitting empty for 8 months because we couldn't find the right person." He paused. "We kept finding people who were either good medics who didn't understand the operational environment or good operators who didn't have the clinical depth. The combination is rare," she said. "Yes." She looked at the floor. "You'd have a rank restored," he said. "Your record expunged of the circumstances under which you left. Full service recognition." He paused. "And you'd be doing what you actually are, instead of what you've been pretending to be." She sat with that for a long moment. "I'm not going to answer that right now," she said. "I'm not asking you to. I need to sleep. I need to see Caleb when he's coherent enough to have a real conversation. I need to—" She stopped. "I need a few days to be a person before I make a decision about what kind of person I'm going to be." "That's fair," Thorne said. She stood up, picked up the protein bar wrapper, put it in her pocket. She looked down at him on the step. "For what it's worth," he said, "the answer you give doesn't change what happened last night. You saved his life. That's done. That's real. The rest is just the question of what you do next." "I know," she said. "That's why I need to think about it." She pushed through the stairwell door and went back to work. The afternoon was long and ordinary in the way that afternoons are after mornings that are not ordinary at all. The ER ran its cases, Anna ran her part of it, and the machinery of the department worked the way it worked when it wasn't being overseen by a man who had been using the hospital as a cover for something that had gotten people killed. The difference was subtle, but it was there. A slight loosening in the air, the way a room changes when a persistent irritant is removed and people don't know yet what to do with the absence. Torres worked a trauma case in Bay 1 and pulled Anna in for a consult on a vascular assessment, which he had never done before, had never had to do before, because Hale's hierarchy had made lateral consultation feel like a confession of inadequacy. He did it simply, professionally, without preamble. "What do you see?" he said. She looked. She told him. He nodded and proceeded. It was a small thing. It shouldn't have felt like anything. It felt like something. At 6:15 p.m., Riggs came to the ER. He found Anna at the charting station and sat down across from her with the manner of someone who had something to say and was working out how to start. "Caleb wants to see you," he said. "I'll go up when my shift ends." "He's asking specifically." Riggs paused. "He's got information he needs to give to the investigators, about the mission, the ambush, some details about the access point that could tighten the case. But he said he'll only do it if you're in the room." She looked at him. "That's not a condition I can officially facilitate," Riggs said. Foley made that clear. "Witness interviews have protocols, but Caleb is technically a voluntary cooperating witness, which means he can have a support person present." Another pause. "And apparently you're his support person." "He's decided this. He's decided this." She looked at her chart. She looked at the clock. My shift ends at 7. He'll wait. She went up at 7:04, still in her scrubs, still wearing the secure phone on her hip, still carrying the specific tiredness of someone who had been running on something other than sleep for going on 18 hours. She stopped at the ICU nurses station to check the board and found Caleb's numbers good. Genuinely good. The kind of good that means the body has committed to surviving rather than just tolerating it. She went to bed 7. Caleb was sitting up. Not upright. The bed was at an angle and there were pillows involved, but sitting, which was categorically different from the supine shape he'd been since midnight. He looked like he'd been beaten thoroughly and then repaired, which was accurate, and also like himself in a way that the sedation had been suppressing. You look terrible, she said. You look tired, he said. Fair. She pulled the chair to the bed. Riggs says you're being difficult about the interview. I'm being specific, he said. There's a difference. He looked at her for a moment. I'm going to tell them everything I know. I'm going to tell them about the communication that went out 24 hours before the ambush, the one that confirmed our extraction point, and I'm going to tell them that I had a bad feeling about it at the time, that I didn't escalate because I didn't have enough to go on. He stopped. I'm going to tell them that's on me, that 4 people are dead partly because I didn't push on something I felt. She looked at him. That's not why you want me here, she said. No, he said. I want you here because there's something I couldn't tell Riggs, something I couldn't tell Thorne, and I need to tell someone who will understand what it means and know what to do with it. The room was quiet. Tell me, she said. He looked at the window. Outside, the evening had come down over Fairmont City. The late light going orange and then gray. The city doing what cities do, regardless of what hospitals contain. The communication that confirmed our extraction point, he said. It didn't come through the hospital network. We've confirmed that now. That was a secondary relay. That was Hale. But the original compromise, the one that put our mission parameters into the network in the first place, he stopped. It wasn't Hale. Hale didn't have access to the mission parameters. He had access to my location and status once I was in the hospital, and he passed that to the network. But the mission parameters, the coordinates, the timing, the asset identity, those came from somewhere else. Anna went still. There are 9 names on the original access list, she said slowly. 7 cleared, Caleb said. 2 still under review. He looked at her directly. Anna, I know who it is. I know which of the 2 remaining names. I couldn't put it together until I was in this bed with time to actually think, but the communication I flagged, the one I had a bad feeling about, it came from a source that I've been running through my head for 2 days, and I know now what I was feeling. Who? She said. He told her. She sat with the name for 3 seconds, which was how long it took her to understand the full weight of it. Not just the identity, but the access that identity would have had, the duration of it, the scope of what could have moved through that access point over the course of the months the FBI had been watching the network's foreign end while the domestic source had been standing in plain sight. She stood up. I need to call Foley, she said. I know. Right now. I know, he said. That's why I needed you here, because you're the only person I trust to make that call without anything getting in the way of it. She already had the phone in her hand, and then her phone lit up with Foley's number before she could dial. And when she answered, Foley's voice had the taut, controlled quality of someone delivering information they are actively doing something about. Anna. One of the 2 remaining names on the access list just attempted to access a classified communication terminal using credentials that expired 6 weeks ago. They're in the building. Anna looked at Caleb. Which building? She said. A pause that lasted exactly long enough to confirm what she already knew. Yours, Foley said. Which floor? Anna said. 3rd. Administrative wing. The terminal is in the records management office. It's a legacy system that still has a network bridge to the classified relay used during the hospital's military contract period. Whoever this is, they knew the bridge existed. That's not public knowledge, Anna said. That's institutional knowledge. Someone who's been here long enough to know the hospital's infrastructure at a level that doesn't show up in the org chart. Our people are 60 seconds out from the building entrance. I need you to stay where you are. I'm on the ICU floor. Stay there. She looked at Caleb. He was reading her face the way he'd always been able to read her face, which was completely with the accuracy of someone who had watched her make decisions under pressure and learned the tells. Go, he said. Foley said, Anna. His voice was rough and certain. Go. She went. Red. The third-floor administrative wing was quiet in the way that institutional spaces are quiet after business hours. The kind of quiet that has texture to it, the hum of HVAC and the distant sound of the building's working systems, no human noise. The overhead lights were on their evening setting, dimmed to 60%, which threw the corridor into a half-light that made distances harder to read. Anna came out of the stairwell and stopped. She was operating without authorization, without a weapon, without backup that had arrived yet, and on a phone call with a federal agent who had told her to stay put. She was also the only person currently on this floor who knew the building's layout at the granular level of someone who had worked in it for 5 years. Every supply closet, every exit, every camera blind spot, every door that stuck and every door that didn't lock properly, despite what the maintenance logs claimed. She moved along the wall toward the records management office. The door was closed, but there was light at the bottom of it. Interior light, not the overhead. A desk lamp or a monitor. Someone had turned on a light in a room that should be dark and locked. She pressed her back to the wall beside the doorframe and listened, typing. Rapid, purposeful. The sound of someone working through a process under time pressure. She texted Foley. Third floor records. I'm at the door. They're inside, active on the terminal. The response was immediate. Do not engage. Team is in the elevator. She looked at the door. She thought about what was on the other side of it. Not just a person at a terminal, but whatever they were transmitting. If the communication went out before Foley's team got there, the intelligence value of catching this person was reduced to the body. The chain, the network, the foreign handlers, the parts that mattered most, would have time to move. She didn't engage. She did something else. The records management office had a secondary entrance from the administrative supply corridor, a connecting door that had been used when the records office and the supply room were the same department before the hospital's renovation 6 years ago. The connecting door had been nominally locked since the renovation. Nominally because the lock had been broken and reported 3 times and repaired twice and broken again, and the last maintenance ticket on it was 14 months ago and marked resolved, which it was not, because Anna had tried that door 8 months ago looking for a patient file that had been misfiled and the lock had turned freely. She moved to the supply corridor. She tried the connecting door. It opened without sound, which was not guaranteed and was the first thing in the last 24 hours that had gone cleanly right. The room was small, filing cabinets on 2 walls, a work table with a terminal in the corner, and a desk lamp throwing a circle of light that didn't reach the connecting door. The person at the terminal had their back to her, which meant they hadn't heard her come in, which gave her approximately 4 seconds before instinct or peripheral vision corrected that. She looked at the person, she looked at the screen, and she understood. In the way you understand things that have been true for a long time, but needed one final piece to become visible. Why the investigation had been running for 14 months without closing. Douglas Fenner, the hospital's CFO, was 61 years old and had been at Riverside Valley for 19 years. He had been there before Hale, before Greer, before most of the current medical staff, a constant in the institutional landscape, the kind of person who attends every retirement party and every budget meeting and becomes, over time, structurally invisible, not because he lacks presence, but because his presence becomes as unremarkable as the building's plumbing. He knew the infrastructure because he'd been there long enough to watch it installed. He knew the military contract bridge because he'd signed the original paperwork. And he had clearly known how to use it without appearing in anyone's primary analysis, because when investigators look for intelligence leaks, they look at people with access to the intelligence, and Fenner's access had been institutional, a CFO's broad administrative reach into systems that weren't his primary function, but were technically within his authorization scope, in a hospital that had never audited those permissions because nobody thought to look at the CFO's network credentials when the IT contractor logs pointed to clinical department authorizations. Hale had been the relay. the useful asset with leverage. Fenner had been the source. He was transmitting now, and she could see enough of the screen from the angle of the door to understand that what was going out was not mission parameters or patient location data. It was something else, a final package. The kind of thing you send when you know the structure is collapsing and you're trying to get everything of value out before the walls come down. She said, "Stop." He froze. He didn't turn immediately. There was a half second where she could see the calculation happening. Continue transmitting, the progress bar was at 60%. And then she moved to the terminal and pulled the network cable from the back of the machine, and the progress bar stopped at 63%, and whatever had been going out stopped going out. He turned then. Douglas Fenner looked at her with an expression that was not what she expected. Not panic, not the animal calculation she'd seen in the man in the maintenance uniform that morning. What was on his face was something older and more tired than panic. The look of someone who had been carrying a thing for so long that being caught was almost a relief. Except it wasn't, not entirely, because there was real fear underneath the exhaustion, and he was old enough to understand exactly what the fear was about. "Miss Beckett," he said. "Mr. Fenner," she said. They looked at each other across the desk lamp's circle of light. "How long?" she said. It wasn't the most important question. It was the one she found herself asking. He was quiet for a moment. 11 years, he said. 11 years. She had been a captain in the field while Douglas Fenner had been passing information through a hospital's infrastructure, and she had been a nurse in his building for 5 of those 11 years, and neither of them had known what the other was until tonight. "They approached me during a difficult period," he said, and she could see him deciding how much of this to give, the same way people in extremity always begin the sentence they aren't sure they should finish. "My son had debts that were going to—" He stopped. "It doesn't matter now." "No," she agreed. "It doesn't." The door to the corridor opened and Foley came through it with 2 agents behind her, and the situation ended the way the situation that morning had ended, quickly, with the language of federal procedure and the sound of handcuffs, which is a very specific, small, final sound. Foley looked at the disconnected network cable. She looked at the progress bar frozen at 63%. She looked at Anna. "The transmission," she said. "Stopped at 63%, Anna said. "I don't know what was going out, but they didn't finish getting it out." Foley's forensics agent was already at the terminal. "We can recover what was transmitted and what wasn't," he said. "The 63% they got is recoverable from the network log. We can see both ends." "Good," Foley said. She looked at Fenner, who was being read his rights by an agent with the careful articulation of someone who understood these rights were going to be important in what followed. Then she looked back at Anna. "I told you to stay on the ICU floor." "You did," Anna said. "The connecting door." "Maintenance backlog." Foley pressed her lips together in the way of someone making a decision about what kind of conversation to have. "I'm going to need a full statement from you. Tonight, if you're—" "I'll give you the statement," Anna said. "But I need to go back to the ICU first." Foley looked at her for a moment. 20 minutes, she said. "Then I need you in the conference room." Anna went. No. Caleb was exactly where she'd left him, which was to say upright and watching the door with the alert patience of someone who had decided worrying was a waste of what energy he had. She came in and sat down in the chair. "Fenner?" she said. He exhaled. "You got him." "Foley's people got him. I got in the way of a transmission." She looked at her hands. They were steady, which was something she noted without particularly feeling. 11 years, Caleb. He's been doing this for 11 years. He absorbed that. She could see him running the math the same way she had. The operations that could have been compromised. The assets that could have been burned. The people who might have made it home, who hadn't. "You can't do that math," he said. "You'll do it anyway, but you can't solve for it." "I know." 11 years means it predates both of us in our current roles. It predates your time here. You couldn't have stopped it by being somewhere different. He said it with the flat precision of someone who had learned to separate the fixable from the unfixable the same way she had, in the same kinds of places. What you stopped is what you stopped. The transmission. Tonight. She looked at him. "The 4 operators," she said. "Yeah," he said. It was all he said. and it was enough because there wasn't a framing that made it better, and he wasn't going to try to provide one. They sat with it for a while. The monitors ran their numbers. Outside the window, the city was fully dark now, the lights of Fairmont doing what city lights do. Indifferent, continuous, the background noise of a world that keeps moving at the speed of its own business regardless of what happens in hospitals. Thorne offered me a position, she said. He was quiet. You knew, she said. He mentioned he was going to, and you didn't tell me. Not my place to tell you. He shifted, adjusted for the discomfort of being a person who had a chest opened 12 hours ago, and settled. What are you going to do? I don't know yet. She looked at the window. I came here to be no one. I thought if I was no one long enough, it would start to feel natural. Did it? She thought about it honestly. Parts of it, she said. The work, the actual nursing. That was real. I was good at it for reasons that weren't about hiding. And Delia, Torres, a little, she paused. But the rest of it, the beige scrubs, the empty locker. She stopped. I was performing invisible. I was working very hard at something I told myself was peace. Is there a difference? Yes, she said. Peace is when you're actually okay. What I was doing was maintenance. He nodded slowly. You can do both, he said. The position Thorne is offering. It's not the field. It's not what we did. It's different. I know what it is. You could have the work without... Caleb? She looked at him. I said I don't know yet. I don't know yet. Okay, he said. He almost smiled again, and this time it got a little further than the night before. I'll stop. Thank you. A pause. I'm glad you're not dead, she said. That makes two of us, he said. The statement took 90 minutes and covered, in chronological order, everything from the moment the ER doors opened the previous night to the disconnected network cable 40 minutes ago. Foley asked good questions. Precise, non-leading, the kind that built a record rather than a narrative. Anna answered all of them accurately, including the parts where she hadn't followed instructions, which she stated without apology because she'd made those decisions with the information she had, and she stood by the math. Foley didn't comment on the parts where Anna hadn't followed instructions. At 10 p.m., Anna Beckett walked out of the conference room into a hospital that was running its night shift with a quietness that felt, tonight, genuinely earned. She stopped at the nurse's station. Delia was there. She'd come back in for a double, which she sometimes did when the department needed bodies and she had the energy, and she looked up when Anna appeared. You're still here, Delia said, giving a statement. I heard. A pause. I heard about Fenner. News moved fast in hospitals. It always had. What did you hear? That he was arrested. Federal charges. Delia looked at her. 19 years, Anna. He signed my performance review last year. He gave the speech at the nursing staff appreciation dinner. She shook her head. I keep trying to make it make sense, and it doesn't. It doesn't have to make sense, Anna said. It just has to be handled. Delia was quiet for a moment. Are you okay? Anna thought about it. It was the second time in 24 hours Delia had asked her that, and this time she took the question seriously instead of deflecting it. I'm tired, she said. I'm going to be tired for a while, but yes, I think so. Delia looked at her for a long moment. The look of someone who has watched a person carefully for long enough to have opinions about them that go beyond the professional. You've been somewhere else this whole time, she said, even when you were here, and last night was the first time I saw you actually present, completely. She paused. Whatever comes next, don't go back to wherever you were. Anna looked at her. Go home, Delia said. Sleep. Eat something that isn't a protein bar. How do you know about... I've been watching you replace that protein bar every Monday for 3 years, Delia said. Go home. Anna went. She slept for 11 hours, which was not something she had done since before her discharge, and she woke up at 9 a.m. to 4 missed calls. Foley, Riggs, Thorne, and a number she didn't recognize, and the specific disorientation of someone whose inner sense of what the world is supposed to look like has been significantly rearranged. She made coffee. Real coffee. not the cafeteria variety. She stood at the window of her apartment and looked at Fairmont City in the morning light, the particular unremarkable landscape of a mid-sized American city doing its Thursday, unaware that the hospital visible from her building had spent the last 36 hours as the site of something that would probably never be publicly described. She called Thorne back first. "The transmission Fenner sent," she said, before he could speak. "The 63%. "Our analysts worked through the night," Thorne said. It was a communication structure document, the domestic network architecture he'd been running. Names, relay points, contact protocols, valuable to whoever received it. But it was also a gift to us because the 37% that didn't transmit contains the foreign end of the network. The handlers, the addresses, the chain. He paused. "We're moving on 3 foreign nationals today, the network that's been running for 14 months. It ends this week." She stood at the window and let that sit. "Because of a broken lock on a supply closet door," she said. "Because you know your building," Thorne said. "Because you pay attention to things other people file and forget." She drank her coffee. "The position," she said. Thorne went quiet in the way that meant he was giving her room. "Tell me what it actually looks like. Not the title, the actual work." He told her. It took 12 minutes, which was longer than she expected, and the picture that emerged was not what she'd imagined when she'd been turning it over. It was smaller in some ways and larger in others. Field protocol development, clinical training for special operations medical teams, the intersection of battlefield medicine and operational planning, working with the FBI's Critical Incident Response Medical Unit, a role that lived in the space between the military world she'd left and the clinical world she'd built, which was, she realized as he described it, the space she'd actually been living in all along. She had always been both things. She'd just spent 5 years trying to pretend she was only one of them. "When do you need an answer?" she said. "Yesterday," Thorne said. "But I'll take today." She almost laughed. "Give me until Monday." "You have until Monday." She hung up and stood at the window for another few minutes. Then she called the number she didn't recognize. It was Caleb. A hospital phone. He'd asked a nurse to dial for him, which she could picture exactly, the slightly sheepish expression of a man unaccustomed to needing help with small things. "You're awake," he said. "You're making phone calls." "My arms work." A pause. "Guo says I can transfer to a military medical facility in 4 days. They're talking about Landstuhl depending on the recovery trajectory." "Good," she said. "That's good." "I need to know something," he said. "Ask." 8 months ago, when I tracked you down, when I found out you were in Fairmont City, I thought about telling you I knew where you were. I decided not to." He stopped. "Was that the right call?" She thought about it honestly, which meant she had to think about what the last 8 months had actually been. The protein bar every Monday, the empty locker, the careful performance of ordinary. What would she have done if she'd known he knew? "Probably not," she said. "At the time. But it doesn't matter now." "It matters to me." "Then here's the honest answer," she said. 8 months ago I wasn't ready. I'd have run, and I needed to stay where I was long enough to find out I was done running." She paused. "So maybe it was the right call for the wrong reason." "I'll take it," he said. "Rest," she said. "Stop making phone calls." "Yes, ma'am," he said, which was something he'd never called her in the field. The rank had always felt sideways between them, and the fact that he said it now with that particular tone meant something she wasn't going to try to translate. She hung up and drank the rest of her coffee and made eggs, which were slightly overcooked because she'd been staring out the window instead of watching the pan, and she ate them anyway because they were real food, and she had promised Delia. 3 days later, Riverside Valley Medical Center held what the administrator called an emergency staff briefing and what the staff called the most extraordinary departmental meeting in the hospital's 40-year history. Sandra Voss, the administrator, not the sergeant, addressed the ER staff in the main conference room with a directness that suggested she had spent the previous 72 hours making decisions about what kind of institution she wanted to run. She confirmed what most people had already heard in pieces, that Dr. Victor Hale was in federal custody facing charges of conspiracy, obstruction, and complicity in an attempt on a patient's life. That Douglas Fenner had been arrested on espionage-related charges, that an FBI counterintelligence investigation had been active in the hospital and had concluded with multiple arrests, that 2 federal agents would remain on site for the coming week as a procedural matter. She did not minimize it. She did not use the word isolated or unprecedented or the phrase our thoughts go out to in a way that closed the topic before it opened. She stood in front of the people who had worked in this building for years, and she said, "This happened here, some of it for years, and we didn't see it, and that is something we have to reckon with." Then she said Anna Beckett's name. She said it in the context of a patient who was alive because a nurse had refused to be dismissed, who had acted with clinical precision under pressure and institutional obstruction, who had then spent the following 36 hours contributing to a federal investigation that had ended a network that had cost 4 military operators their lives and had attempted to cost a 5th. She did not use the phrase "went above and beyond" because that phrase is what institutions say when they want to acknowledge something without examining why it was necessary. She said instead that the hospital had failed to protect one of its best clinical staff from a department chief whose authority had been used punitively and incorrectly, and that the clinical standards review that had been filed against Anna Beckett was being closed without action and expunged from her record. The room was quiet in the way rooms are quiet when something true is said in a register that institutions don't usually use. Anna was at the back of the room. She did not stand up. She did not acknowledge it demonstrably, because that wasn't what the moment required, and also because she was tired of being the subject of rooms. She met Delia's eyes across the space, and Delia gave her a small, solid nod, and that was enough. Torres was sitting 3 rows ahead of her, and he turned and found her face and looked at her for a moment with the expression of a second-year resident whose understanding of what nursing was had been permanently revised, and she held his gaze and didn't look away, because that was worth giving him. After the briefing, she went back to work. Not because she wasn't processing everything that had happened. She was in the slow, unglamorous way that processing actually works, which is mostly while you're doing other things and the understanding accumulates in the background. But the ER was a department that had just lost its chief and its CFO in the same week, and the patients who came through its doors did not have the option of waiting for the institution to stabilize. And there was work to be done. She did the work. She did it well. She had always done it well. On Monday morning, she called Thorne. "Yes," she said. He was quiet for a second. "Say it again." "Yes, I'll take the position." She was standing at the window again. It had become, without her planning it, the place where she made decisions, looking at the city in the early light. "I want 2 things. Tell me." The nursing license stays active. Whatever the role looks like, I maintain my clinical credentials and I work in a hospital environment as part of it, not as cover, as the actual job. "That's already built into the role description," Thorne said. "And Caleb's team," she said. "The 4 operators. I want their families to have a point of contact, someone who can talk to them, not about the classified parts, but about who those men were in the field, what they did." She paused. "They shouldn't be handled by a form letter." Thorne was quiet for a moment. "I'll make that happen personally," he said. "Then yes," she said. "I'll come back." She hung up and stood there for another few minutes, watching Fairmont City do its ordinary morning. She thought about the version of herself who had arrived here 5 years ago with an edited resume and an empty locker and a protein bar she replaced every Monday. The deliberateness of that. The careful construction of a life small enough that nothing important could find it. She had thought, at the time, that she was protecting herself. She understood now that she had been doing something else. She had been punishing herself, in the particular quiet way that people who have survived things they didn't ask to survive sometimes do. Not loudly, not dramatically, just by making herself smaller and smaller until surviving felt like the most she deserved. Caleb had pressed her hands against her own wound and told her she was not allowed to die. She had spent 5 years figuring out what that meant. It meant more than breathing. She worked her last regular shift at Riverside Valley the following Friday. She didn't announce it as a last shift. It felt wrong to make the ordinary workday into a ceremony. And also the staff had experienced enough extraordinary things in the past 2 weeks to deserve one unremarkable Friday. She triaged, assessed, administered, documented. She pulled Torres into a consult on a chess presentation that turned out to be musculoskeletal, and watched him work through the differential with the careful precision of someone getting better at something he cares about. She changed 2 IV lines, talked a frightened 70-year-old through a cardiac monitoring protocol, and helped a resident find the vein on a difficult stick that she found in 30 seconds because she'd always been able to find veins that didn't want to be found. At the end of the shift, she went to her locker. It was empty, which was how she'd always kept it. She stood in front of it for a moment and thought about the protein bar. She had not replaced it last Monday. It had felt like the first real decision she'd made about who she was going to be, which was perhaps too much significance to put on a protein bar. But she had lived alone for 5 years, and there was no one to tell her how much significance was appropriate, so she'd put it where it fit. She closed the locker. Delia was in the corridor outside the locker room. "You're leaving," Delia said. Not a question. "I'm leaving," Anna confirmed. Delia looked at her for a long moment. She had questions. Anna could see all of them, the specific curiosity of someone who had watched a person for years without knowing who they actually were. And she was, as she had always been, the kind of person who knew when to ask and when to hold them. "Will you come back?" she said. Just that. Anna thought about it honestly. "Probably," she said. "In some form. The role I'm taking, it keeps me in clinical environments. I don't know which ones yet. But not this one." "Maybe this one," she said. "Eventually." Delia nodded. She looked at Anna with the directness of someone who had earned the right to it. "You were the best nurse in this department," she said. "You've probably been the best nurse in every department you've ever worked in. I want you to know that I know that. Not because of last week. Because of every week." Anna looked at her. It was a harder thing to receive than the administrator's acknowledgement in the conference room. Harder than Thorne's offer. Harder than the federal record being updated with her correct history. Because it was specific, and it was true. And it was about the work, the actual everyday work of caring for people in the ordinary moments before things become extraordinary. And it was the part of herself she'd been most afraid to value. "Thank you," she said. It came out quieter than she intended, which meant it was real. Delia hugged her. It was brief and unsentimental and exactly the right length. Then she went back to work, because the department needed her, and Anna walked down the corridor and out through the ER doors into the morning for the last time as the nurse no one was looking at. She drove to the military medical facility where Caleb had been transferred 3 days earlier. It was 40 minutes outside Fairmont City, on the far side of a highway interchange that opened into the flat institutional landscape of a base perimeter. She showed her credentials at the gate, new credentials, which still felt slightly unreal in her hand, and drove through. He was sitting up in the bed when she came in. Actually sitting, not propped, with the look of someone whose body had committed to its own repair. He looked better. He looked, in fact, like himself. The version that existed before the stretcher, and the blood, and the OR. The version she'd known in the field. He looked at her when she came through the door. "You said yes," he said. "How do you know?" "You have a different walk," he said. "You've always had a tell when you've made a decision. You stop carrying the weight of the question." She sat down in the chair by the bed. "I didn't know I did that." "I know, that's what makes it a tell." He looked at her steadily. "How does it feel?" She thought about it honestly, which was the only way she knew how to think about things. "Strange," she said. "Correct, both at the same time." That's how the right things usually feel. She looked at him. The morning light was coming through the window at an angle that made the room look like a different kind of room than the one she'd been sitting in. Less like a hospital, more like a beginning, which was perhaps too much to ask of light and a window, but was what she had to work with. "You told me I wasn't allowed to die," she said. He looked at her. He remembered. She could see that he remembered every word of it. "I meant it," he said. "I know you did," she said. "I spent 5 years figuring out what it actually meant." "And?" She looked at the window. "It meant I wasn't allowed to do what I was doing either," she said. "Dying slowly in a beige uniform because I thought making myself small was the same thing as being safe." She stopped. "You can survive something and still spend years not being alive. I was doing that. I was very good at it." He was quiet. "I'm done being good at that," she said. Outside the window, the base perimeter ran its ordinary morning, vehicles moving, people with purpose going where they needed to go. The machinery of an institution that had, at its best, something to do with protecting people who couldn't protect themselves. She had spent years deciding what she thought about that machinery, about her place in it, about whether the cost of what it asked was something she could keep paying. The answer was not simple, and had never been simple, and she wasn't going to pretend otherwise. But the alternative she'd tried, the empty locker, the invisible life, the careful diminishment, had its own cost, and she had been paying that one too without acknowledging the invoice. You don't get to put down who you are. You only get to choose whether you carry it honestly or whether you spend your life pretending it isn't there, and the pretending is heavier than the thing itself. She had learned that the hard way, in the only way that lesson seems to get learned,